Good afternoon, everyone. My name is Shanae McPherson. I am the Volunteer Connect 55 Plus Administrator for Orange County Department on Aging, and we would like to welcome you all for joining us this afternoon. We're excited to have you, and we are looking forward to a wonderful program that's going to offer valuable information for everyone that's joined us today. So this afternoon, we are proud to present the End of Life Care Planning Program, sponsored by Orange County Department on Aging and sponsored and hosted by our End of Life Choices Senior Resource Team. We have a panel of 4 wonderful speakers joining us this afternoon to provide valuable information on an end of life care planning and the steps that you need to take. So as we think about our end of life journey, there's so much to consider when you have to factor in everything involved with end of life care. And it can be somewhat overwhelming. So today our panelists are going to provide information on the Conversation Project, how to select a healthcare power of attorney, understanding the Standard Advance Directive form from the state of North Carolina, and the Supplemental Advance Directive for Dementia Care form. So we will also be providing all of these resources on the screen and in the recording. We have a list of resources that will be provided at the end of the program as well to make sure that you all can tap into all of the valuable information that we can give you. So Kimberly, if you want to go ahead and start the presentation for me.
We are ready for Sheila Evans to begin.
No, I just need you to start the presentation for me.
Oh, I'm sorry. I thought it was sharing screen. Here we are.
Okay. And if you'll back up one slide for me.
Yes. My apologies.
There we go. So today, just briefly before we get started and I hand it off, today's speakers that are joining us today are Sheila Evans, Ina Stern, Colin Austin, and Ed Tiriakian. And we are very pleased to have all 4 of you joining us this afternoon. So I will now turn it over to Sheila.
Thank you, Shanae. I'm going to talk about the Conversation Project. It is a nationwide campaign to help people talk about their wishes for end-of-life care. It's known that approximately 70% of people want to die at home, but actually, about 70% of people die in a healthcare facility, a hospital, or a nursing home. One of the reasons for this is that many people find it very hard to actually have a conversation about death and dying and end of care wishes. The Conversation Project helps to ensure that your wishes for end-of-life care will be expressed to your loved ones, your doctor, your friends, and respected. So how does the Conversation Project work? It's really pretty easy. It's 3 steps. Step 1 is get ready. You meet with a small work group. And yes, it is easier to meet in person rather than virtually. You are given 2 questions to answer in writing that help you get started thinking about your wishes and your concerns. Things you might want to be sure you discuss. It could be finances, burial, care of a loved one. Within the group, you work in pairs or 3 and you talk about these questions. And then step 2 is get set. You write down what is most important about how you want to live at the end of life. This might be you want to stay home, or you want to be pain-free, or maybe you want to receive excellent nursing care somewhere. You will discuss this with your partner and then with the whole work group. And step 3 is go. So we've done get ready, get set, and now we're to go. When you are ready to have the conversation, this step helps you plan who you want to talk to, when you want to have this conversation, where you want to have it, and what you will actually say. And then perhaps you are actually going to have the conversation. Many groups later meet in a couple of weeks and come back to the group and talk about their experiences having the conversation, what they want to change for another time, what they want to clarify. Because the conversation is not a one-time deal. You should have the conversation many times. On a personal level, I was a lucky one to have this conversation with my husband about a year before he got dementia. So I was able, when I was a caretaker, to know just what he wanted for his end-of-life wishes. So I didn't have to second guess it, and I didn't have to feel guilty about decisions I was making because I knew this is what he wanted. And then I had the conversation with my family. And again, I had a conversation when the pandemic struck, because then I wanted to talk about ventilators and hospitalizations. So it's an ongoing process. So perhaps now you've had the conversation, and now it's very important to complete 2 legal documents. One is choosing a healthcare proxy, and the other is completing an advance directive. So now I will pass the stage to my friend and project engager, Ina Stern. Thank you.
Thank you, Sheila. Hi, everybody. My name is Ina Stern, and I'm a graduate of Project Engage, as Sheila said. And that experience in Project Engage led me to become an advanced care planning facility, working with a study at Duke University. I help patients and their families learn how to plan for future healthcare decisions. And one of the first things I learned about advanced care planning is that the most important decision you can make is choosing the right person to be your healthcare agent, otherwise known as your healthcare proxy or your healthcare power of attorney. And for this discussion, I'm going to use the term healthcare agent. Let me be clear about what a healthcare agent is. It's a person who you choose to make healthcare decisions, including end-of-life decisions, in the event that you are unable to make decisions for yourself, either because of serious illness or injury. In most states, a physician determines if a person is unable to make their own decisions. Your healthcare agent can then talk with your doctors, consult your medical records, and make decisions about tests, procedures, and other treatments, and about starting or stopping life-prolonging measures as per your wishes. The importance of choosing a healthcare agent cannot be overstated. Too many people, and this is actually half of all people over 65 who are admitted to hospitals, are unable to make decisions for themselves. Now, you may have somebody in mind who you would like to take on this role. Don't assume that the person you choose to be your healthcare agent already knows your preferences for future medical care, including end-of-life care. You need to have a conversation that will reassure both of you. I've spoken to many moms who've said, my son, my daughter, they know exactly what I want. I don't need to talk to them about it. We've mentioned it over the years. No, you really need to focus. And you're making somebody that you trust your healthcare agent, which will ease your own concerns about aging and your future. And it can also help your loved ones avoid unnecessary difficulties during what might be an emotionally stressful time. A healthcare agent does not need to be a medical expert, but they should have other important qualities. There are 4 things that the person you choose should be able to do. Number 1, they should be able to accept that this role is being given to them because you trust them with your life. It's a big responsibility, and you should both acknowledge that. They should be comfortable speaking on your behalf. They will be your advocate. They will be your voice, and they should be willing to stand up for you. Number 2, they should be willing to talk with you about your goals, your values, and your preferences. Just like Sheila was talking about in the conversation project. It's that kind of a conversation, but really focusing on healthcare issues. The guidance that you give your agent comes from having these focused conversations with them and with your loved ones over time. And your agent should be able to listen to you. You need to tell them how you would want to live the final chapter of your life. Clarify your values, your religious beliefs, your goals of treatment, like whether you'd want extensive life prolonging treatment or just be made comfortable if that's possible. So make your healthcare agent, as well as your healthcare providers, aware of all this, as it will help them to implement things when the time comes. This is not just a legal task. At heart, it's a kind of a communication exercise. And don't be afraid to use the D word. It's hard to talk about dying and illness, but it's a lot harder for a loved one to make a decision without having a clear sense of what you would want. And to help make these conversations easier, as Sheila mentioned, there are a lot of guides available for having these discussions, and we'll show you where you can get some of those guides on a slide at the end. Number 3, your healthcare agent should follow your decisions even if he or she may not agree with them. Choose someone who will talk with you now about your wishes, who will understand what you want and what your priorities are about healthcare, and who will do as you ask faithfully when the time comes, even if they disagree with the choices you've made. So if you're just having a conversation like this with your spouse and you say, I really wouldn't want to have any life prolonging measures. That's not what I want. No feeding tubes, no. And your spouse says, but I don't know that I could let you go in that way. That's not what I would do for myself. Then your spouse may not be the right person to be your healthcare agent. So you should think about other people in your relationships that might be better suited. Number 4 is that you should choose somebody who can make decisions in difficult times. Sometimes a spouse or an adult child may not be the best choice because it just might be too difficult for them. It's okay to choose a friend. It's okay to choose perhaps a more distant relative or someone at your place of worship. It should be someone who can handle conflicting opinions from family members, friends, medical personnel, someone who can be a strong advocate for you if a doctor or the institution is unresponsive, and somebody who's able to ask questions of busy healthcare providers and then ask for clarification if they don't understand a situation or an answer. And they should be able to handle the emotional stress that might come with following your instructions. Ideally, you should choose an agent who is somebody that lives near you or could travel to be with you. And you should choose a backup in case your primary agent is unable to serve when needed. In the North Carolina healthcare proxy document, there is space for 3 names. And you cannot have more than one person designated at a time, but you pick your primary, your backup, and then a tertiary if you would like that too. Having said all this, I don't want to make the task of being a healthcare agent sound too hard. Some of you have already been healthcare agents for others, as I was for both of my parents. So you already know what it entails. You put yourself in your loved one's shoes and do your best to make sure that their wishes are carried out. It's an honor to be chosen for this job. So after you've had the conversations and your healthcare agent has agreed, that's when you will fill out the healthcare power of attorney form required by the state. In North Carolina, it's a separate form, separate from the Advance Directive for a Natural Death, which Colin will be talking to you about. If you use a form called the 5 Wishes, which is kind of a booklet, both the healthcare power of attorney and the Advance Directive are in one place. And you can get a copy of the 5 Wishes from the Department on Aging. And in the state of North Carolina, your document will need to be signed by 2 witnesses, and it will need to be notarized. You would keep a copy, you would give a copy to your agent, and one to your physician to be put into your medical record. And then you should make sure that everybody in your family who needs to know does know about your choice of agent. And you should also realize that your goals and your preferences might change over time as your health and your level of functioning change. So that's another reason that you should review these forms, these documents periodically and discuss them with your agent. And I don't think I have too much time left, but if you want to take a look at the form itself, we can put up the slide. And we have that.
The slide is up for you now, Ina.
I'm not seeing it on my screen.
Okay, hoping you can see it on. Is everyone else able to see it on your screen?
No, we can't see it at all.
Well, I'll tell you, I'll just tell you, it's pretty simple. It's self-explanatory, but there are some important things to know about it. Okay. First of all, it's fully revocable. If you change your mind about who you want, if something happens and the person you choose to be your healthcare agent is no longer available to you down the line, you can revoke the document. All you have to do is create a new one, destroy the old one, tell your doctor, tell your family, tell your healthcare agent. Nothing is written in stone. It can be changed. There are some special provisions that you'll see if you want to limit any of what your healthcare agent has the power to decide for you for whatever reason, you can limit what their powers are. Many people do not, because your healthcare agent will also have a copy of your advance directive. So, oh, there's the form. Well, I think my time is coming to a close, and I'm going to pass this along to Colin Austin to take over. Thank you.
Well, thank you so much. My name's Colin Austin. I'm an attorney here in Orange County. The focus of my practice is estate planning and elder law. And I just want to thank Sheila and Ina for their thoughts about this. We have such good organization around these issues in Orange County. We're really lucky to have you as leaders here and the Department of Aging as backup and support on this. So what I'm going to share a few thoughts about will have to do with what's called advance directives. That means you're filling something out in advance so that your loved ones and family members will know what you want to have happen. And in North Carolina, we have a specific document called a living will or advance directive for a natural death. And what I always tell my clients is, you don't have to have this document. You can have a healthcare power of attorney, and if you don't have any strong feelings about things and just want your healthcare agent to decide, well, they'll have the ability to, but your living will or this advance directive is really the place where you can state, at what point would you want to be let go and who you'd want to make that final decision. And so I think for most people, this is a nice opportunity to have some control over the situation, not just to leave it up to the doctors or to cause confusion or maybe anxiety among your family. It's a great document to have in place so that your wishes can be followed and that things are clear. Let's go ahead and just look at this first advance directive form. As we talked about before, these come from the North Carolina statutes. So they are a bit legalistic and sometimes a little confusing. But let me go through this a little bit, and we'll want to scroll down through Part A here. That's just what Ina was talking about. And here we'll go to Part B. So again, a living will is where it's just really focused on that time if you are unable to communicate yourself, you are on artificial life support. That means artificial feeding, hydration, perhaps breathing, and that you are in a situation where your healthcare providers, usually doctors, determine that you're really not going to be coming back. So let's keep scrolling down this document a little bit. And we'll go right through Part A. This is, you can see here just what Ina was talking about, how you list people. Keep going. Keep scrolling down. Okay. So here in this form, you'll see in number 1, this is what you would initial if you want to state what you want to have happen. So the first one says you have a condition, the doctors determine that death is going to result in a short period of time. The second one is you're unconscious, your doctors determine you're not going to regain your consciousness. The third is you have advanced dementia and your doctors determine that you're never going to regain your cognitive ability. Most people that have these documents often initial all 3, but you have a choice. If there's one of these that you would not want to make a statement about, then you can leave that blank. Let's keep scrolling down a little bit. Number 2, even if you didn't want your life prolonged, you do want to receive artificial hydration or nutrition. You know, most people check those for possible cosmetic reasons, because this may just extend their life for a few more days, but it will not reverse anything. 3, you want to be made as comfortable as possible. There's no selection there. Let me go to number 5, because this is really, I think, the hardest question on this form. It says, and it's, you're saying either the first option is you want your healthcare agent to follow what is in this, what you're saying in this living will. And the second option here is you want your healthcare agent to make that final decision. I've found when I work with clients that this is the hardest one, and when sometimes they need private time or need to think about it over a couple of days or however long they need. Let me tell you kind of practically how to think about some of these questions. The people often choose the first option, that they're taking it out of the hands of their healthcare agent if they do not want to burden their healthcare agent with making this decision. They don't want their healthcare agent to be anxious about it. They don't want there to be arguments in the family about this decision. They're just saying, here's what I'm stating. If I'm in this condition, just let me go. It's a very strong statement. The second one is some people just want their healthcare agent to make that final decision. They're saying, these are my wishes. I don't want to be kept alive. However, I just want my healthcare agent to make that final decision, and I'm comfortable that they'll be able to do that. So as you can see, it's a difficult decision, but it gives you, I think, a good way to either relieve the burden from your family and your healthcare agent, or name your healthcare agent as the person that, even though you're stating, yes, I want to be let go in these circumstances, they can just override that at the very end if they need to. So you complete that document there as well as you scroll down, and I think we can close this document now. And let's bring up that second document if we can. And I want to thank Kimberly for helping us with this. Very much appreciate it. So that it's second advance directive form. Let's click on that one at the bottom of the page. Okay. Right. So this is the full-on official advance directive for a natural death. On this first page, I would just note, you'll see in this box, there's some general instructions. In that last paragraph, it talks about the state has an advanced healthcare directive registry. It's part of the North Carolina Secretary of State's office. That can be good. If you want to file this document, they'll keep it in their records in a hospital. You can direct a hospital to get it there. If you do that, my recommendation is always make sure you keep it updated so there's no confusion. That if you have one registered with the state, if you decide to make any changes to that, make sure to update it with them as well. And then just scrolling through this, these are basically the same kind of questions. You'll see those 3 situations. You have an incurable condition, you never regain consciousness, or you never regain cognitive ability. And if you keep scrolling down, here is one difference in this form, which is the full legal form, which number 2, that's a directive to your doctors. And you're saying that your doctor may withhold life prolonging measures, or they shall. So here, even though the doctors may have determined above in 1 that you're really not coming back, they may still want to prolong things. And many people say, no, I just don't want to have the doctors involved. If I'm in this situation, just let me go. So often if people feel strongly that they want to be let go, they will initial the second one shall. And then we had those same exceptions, hydration or nutrition. Again, that just really extends your life for a little while longer. And then if you scroll down to the next part and keep going in 6, here it's number 6. This is the big question, whether you want your healthcare agent to make that final decision, that's the second choice, or first, if you want to say, no, I feel strongly about this, I don't want my healthcare agent to worry about it, just let me go. And you can keep scrolling down and you just will sign that again. And again, it's good to talk through and think through this form. As Ina mentioned, there's another way to go about it, which is the 5 wishes document. And I also think that that can be a good tool as well. In general, I use the North Carolina statutory form, this one that we're looking at right now. It's most recognized by doctors, and but it is a bit legalistic, and it's hard to think through some of these questions. I also really like the 5 wishes document, especially for people if you're doing this yourself. I think that's a good way to go. It's more understandable, and I think it's strong enough. So you have a couple good options. If you're going to get a formal estate plan done, I'd say go ahead and have the statutory form used. It's, if there was ever a question, it's very strong legally. But the 5 wishes document is also very good. The other thing I would just mention as a note before turning things over to Ed is that there have been some nice additions for this for a living will or advanced directive for people with dementia. And so I have seen some and helped clients use some of these where, at different stages of dementia, how you would like those to be played out. But I hope that was helpful. That's a little bit about these advanced directives. It's a difficult thing to think about, but I've loved what has been talked about so far, just the importance of communication and not being afraid to be honest about things and have conversations with the important people in your life. So with that, I will send it on over to Ed.
Good afternoon. Thank you, Colin. Thank you, Ina and Sheila. Thank you all for joining. I was in Project Engage in Series 2, and I became very interested in end-of-life issues. And as a result of that, I started working on a nonprofit which would try to enact medical aid and dying laws, which are similar to the laws in 10 other jurisdictions, which say if you're suffering from a terminal illness and you're mentally competent, a physician can write a prescription, which will allow you to end your life in peace at home. However, the issue I'm going to talk about today has nothing to do with that situation. It's about a far more complicated situation. What happens if, and this can happen to any of us, you contract a dementia, Alzheimer's disease, and you are otherwise physically fit. You are not terminally ill. You will not die a natural death for perhaps years. And instead you'll be a burden to yourself, at least what you want of your life, and you'll be a burden to your healthcare provider, healthcare helper. What can you do in that situation? Well, first of all, I wish I could see a show of hands, ask how many of you have seen the movie Still Alice with Julianne Moore. I think it was 2014, where a brilliant professor notes that every time she goes jogging, she starts getting lost. She forgets things, and she realizes that she's suffering from early onset Alzheimer's. This is not a life that she would want for herself or for her husband and children. I want to start with a story, and that's the story that will lead me directly to the document I would like to share with you this afternoon. It's a story about a husband and wife, and the husband had been very much aware of Alzheimer's in his family. his mother had died a horrible, well, to him, a horrible extended death, a protracted death because of suffering from Alzheimer's. And he and his wife had undertaken never to go through that. And they had mutually signed advance directives that spelled out that in the event that either one of them would contract or be diagnosed with Alzheimer's or advanced dementia, they would not want to continue living. And they would want to suspend any type of life-sustaining treatment. That's the word they used in their form, life-sustaining treatment. And then if fate would have it, the husband did come down with advanced dementia, incapable of recognizing his wife, roaming around aimlessly, has to be institutionalized for a variety of reasons. And the wife has pled for 3 years now to suspend food and drinking, hydration, nutrition for her husband, knowing full well that is what he would want, he would have wanted. He made clear that's what he wanted. But of course, the institution in question will not adhere to those instructions because the words cease life-sustaining treatment are too vague to be helpful. And that's a situation that in fact has occurred in one of the courts out west in Oregon. Exactly this situation came up where one spouse was asking an institution to suspend hydration and nutrition so that it would precipitate through VSED, voluntary stopping of eating and drinking, the death of that person. But you see, one of the problems is that when you tender a spoon of applesauce to somebody, even with advanced dementia, there is a natural reflex that looks like you are welcoming the food or you're welcoming the water. And no institution is going to substitute an earlier judgment that seems to suggest, earlier judgment in the form of an advance directive that seems to suggest that this person, when they were sane and competent, wanted to withhold nutrition and hydration for the contemporary act of voluntarily accepting hydration and nutrition. They will not counter what they think is the patient's current contemporary wishes. And this creates a real predicament. Because imagine yourself, if you did not want to continue once you've been diagnosed with advanced dementia, if you wanted to make sure that your healthcare proxy could give a final instruction that would be adhered to without risk of an accusation of elder abuse or of homicide, in the worst case, that your healthcare proxy's decision to withhold hydration and nutrition, no matter the apparent gesture of welcoming food when offered, that is perhaps something we should all want to have available. Now, right now, as far as I know, no state in the United States has officially recognized the effectiveness of such a document that would make clear that it would be your wish that were you to be diagnosed with advanced dementia or Alzheimer's, you would not want hydration and nutrition, notwithstanding an apparent desire, once you had been diagnosed, an apparent desire to welcome hydration and nutrition. And that's the document I'd like to share with you today. It's called, and it's a bit of an odd name, a SAD, and it is a sad situation. It's a Supplemental Advance Directive for Dementia. Now this directive, and Kimberly, if you could click the link, please. This document was drafted by an attorney for one of the national organizations that takes care of end-of-life issues and addresses end-of-life issues. And it's been carefully drafted to contemplate a legal challenge perhaps in each one of 50 jurisdictions. This document has not yet been tested, so we don't know what it would take to get a court order to prove its effectiveness. But I believe the document that ultimately will prevail in a court of law in America will look very much like this. Now, this is a supplemental advance directive, which means going back to what Colin was talking about and Ina was talking about, before you would even contemplate drafting this document or filling out this document, you should have an advance directive that spells out the normal type of healthcare issues that you might contemplate. You should also have a healthcare proxy. Now, you could have two healthcare proxies. You could have one that would take care of the types of medical issues that Colin outlined for you on that form he showed you. And you could have a second one for just this situation. Just this situation, because this situation is very, very difficult. Emotionally, it's wrenching, it's gut wrenching. Because unlike the situation that Colin described, there is no natural, predictable time of death where you would remove life-sustaining equipment or unplug a ventilator or take you off medicine. We're talking about stopping feeding you and stopping your food and your hydration. And could you scroll down the page, please, Kimberly? So it's a legal document, and keep on going down. And one of the important points I just want to point out is that, stop right there, please. I don't know if you can see where my cursor is, the chosen endpoint. You will determine with your healthcare proxy, what would you consider your chosen endpoint? At what point of advanced dementia would you not want to continue your life, that zombie life, that dark cloud that you've entered into? Would it be when you can no longer recognize your spouse, when you get lost in your house, whatever it is? At some point you'd say, this is no longer me. This is no longer the person I want to be. At that point, you would instruct your healthcare proxy to exercise a determination that you've reached your chosen endpoint, and then you would want to enter into a practice of VSED. And again, if you can see my cursor, voluntary stopping of eating and drinking. Now you might say, well, wouldn't it be easier just give me some medicine that will take care of things quickly, as in medical aid in dying? Well, the problem is that no physician is allowed in America to write a prescription for somebody who is suffering from dementia for medical aid in dying prescription. They can only be written for somebody that's totally mentally competent. And this is the only feasible way of exiting a life when you've been diagnosed with advanced dementia, is voluntary stopping of eating and drinking, a process that in itself can take 10, 14 days, maybe less, depending on your physical state. And it becomes clear if we again go down here in this paragraph, I'm sorry, just stop there. I do not want food or fluid to be held near my mouth to provoke me to open my mouth reflexively. I ask the scent of food not be present in my room. I instruct that I not be hand-fed or hydrated. So these are very, very precise instructions. And I believe that with this level of precision, provided the form has been otherwise properly filled out when you are competent, you have to fill this form out when you are mentally competent, as it like today, not when things, as in Still Alice, get so bad that you have lost the track. If you fill this out today, I believe this is the best hope for any of us who would not want to continue with this in a state of advanced dementia. I think this form is the best available choice. And with that, I'll stop at 10 minutes sharp. Thank you very much.
Thank you, Ed. You actually did great. You had about a minute left that I was counting, so you did really well on that one. So I want to thank all of our speakers. And at this point, we're going to open it up to the audience for our Q&A session. And I do know that we have received one question that's come in. And so Colin, this is directed to you. It says, Colin mentioned that one reason to limit the agent's authority to the directions stated in the document is not to burden the agent when you were speaking to the advance directives. Many people become ill and die solo, that is, with a small or non-existent social network. They may have to name an agent, but not someone they know well. So while they have a legal decision maker, they may not have full confidence. That's my timer, sorry. They might not have full confidence in that person. And they also may not have full confidence in the person's ability to make decisions based on the senior's known wishes. In that case, they may wish to limit the agent's decisions to what's already described in the directive. So if Colin, you want to respond to that comment?
Sure. It's a great point that, for many people, they don't have a really close family member, someone they really trust that understands. They haven't had these incredible conversations that, Sheila has talked to us about that can be so helpful. And so yes, in addition to the situation where you're trying to take the burden off your healthcare agent, this selection could also be used if you just, you feel like if you're in this situation, you want to be let go, and that you don't really have a person that that understands what you would want. Here, I'd also just mention, because this happens in my practice, there will be people that just, they don't have close family members. They don't have, maybe they haven't lived here that long. And so just as a resource that I've also used, not only for the living will, but for a healthcare power of attorney, there is an organization in North Carolina. It's called Corporation of Guardianship. They're located in Greensboro, but they serve the state. I think they're the only group, as far as I know, that will be your healthcare agent if you need them to be. Of course, it's for a fee, but only if needed. So if there are situations, and I have connected them with several clients in the past where that they just didn't have a person that could be their healthcare agent. So that's a good group, but just want to say that's an important comment that was made.
And we're just leaving it open for any additional questions or any additional comments. I know we did receive one that inquired about the various links and resources that we mentioned throughout this presentation. And yes, we will send those out to every registered participant so that you have access to those. And we had another question that came in, and this is directed to Ed. And it says, Ed, have you, excuse me, have there been situations where people beg or pled to be hydrated or fed? And how would you suggest that be interpreted?
Thank you, Byron, for the question. Well, I'm assuming that with your question, you mean someone has signed this advance directive to say, I want to suspend hydration and nutrition when they were competent. And then later on, they, now that they have dementia, they appear to have changed their mind and they're begging, as you said, for hydration. And this is exactly the complexity of the situation we're talking about. Who has the right to decide? Is it the Byron of today that's pleading and begging for food today, even though we know he's got advanced dementia? Or is it the Byron of last year who, fully mentally competent, said, I don't want to live in a state of advanced dementia. I would not want my life would not have meaning to me. It would be too much of a burden an imposition on my loved one and it's not what I want. Who gets to decide? Which Byron gets to decide? And that is why this Supplemental Advance Directive for dementia is such a difficult document, because in that document, you are saying it was the mentally competent Byron last year that gets to decide. Now, once you reach this this point of no return, as the document calls it, chosen endpoint, and you've empowered your proxy, your healthcare proxy, to make the determination Byron's chosen endpoint has been reached. I have to say that the right thing to do is to respect the competent Byron's decision back then, notwithstanding that today you're begging for hydration and nutrition. And I can tell you, one thing I would say at this point is, if you want to fill out this document, do not ask a loved one to be your healthcare proxy. Because if that's your wife or your mother that hears you begging for hydration and nutrition, I guarantee you that person will not deny you. But then they will be denying what you, when you were mentally competent, wanted. So this is why this document is so perplexing, because what you said, I'm almost positive that's the legal case that will come up. Exactly that legal case. You will be institutionalized for some reason. You will be begging for food. You'll say, I'm starving. The healthcare proxy will say to the hospital, you cannot feed him, and it will go to court. I suspect, I would hope, the competent Byron would prevail for legal reasons and for logical reasons. For emotional reasons, I would want the Byron that's begging for food to prevail, because we're all human. So.
Thank you, Ed, for those comments. And Byron, we hope that was very helpful to you. I'm looking now, checking our chat box. And Byron says, thank you, Ed, for your comments. I don't see any new questions, but please feel free. Our panelists are here to answer your questions. Please feel free to drop a message to us here in our chat box. We'd love to hear from you. And most of all, thank you so much for being here today with all of us. It's been a real pleasure. So we're going to just give a few more moments to see if people have questions or comments for us in the chat box.
Also, people do have the option of, if you raise your hand, we can turn your mic on so that you can ask our speakers directly your question.
Yes, and where does one get 5 wishes from? Is a question we have in the chat box. Where does one get 5 wishes from?
So we actually have 5 wishes available at both the Seymour Center and the Passmore Center. And all you need to do is to walk up to the front desk and ask them for a copy, and we have them available. We also have them available in 2 additional languages. We have them in Chinese, and we also have them in Spanish, in addition to our English version. So we have them readily available whenever you need them.
Thank you, Shanae. So Liz, yes, that was her question from the chat box for where to get your 5 wishes form. All right, we have another question coming in. What suggestions can Ina or Sheila make to encourage a reluctant family member to engage in a discussion about possible future incapacity or end-of-life care? And that was directed towards Ina or Sheila.
I'll say that it is a difficult thing for some people to start that conversation with a loved one or with a family member. That's why it's so helpful to fill out and go through the conversation project, because there's so many little hints and little starters on trying to talk to these people that perhaps might not want to talk. What I did with my 3 children is I went through the conversation project and I filled out all the questions, and then I shared that document all filled out with my answers with my children saying, this is just something I've been thinking about, and I wonder if you would read these questions with me or read these answers I have. And that is a wonderful way to open up a discussion, because you're not asking them to do anything other than read something that you have worked on and you have written down. So that's quite helpful. But just going through the conversation project, that whole process is very helpful.
And I can say that I was the reluctant family member for a long time. I was an only child, and I didn't want to have a discussion with my parents about their death or illness, and both of my parents just sat me down one day and said, you know, we trust you, we love you, and we we need you to understand why we want to talk about our future. It wasn't, you know, we have to sit down and we've got to talk about this. We've got to, we have to make our plans. It was really very much about love and trust. And I came around, but it's hard. Yeah, I get it. It's even when you're prepared to have the conversation, it's not easy. But take it step by step. You don't have to do the whole conversation at one time. You can do it over time. And a lot of people say, well, when we get together for the holidays, we'll talk about it. That may not be a great idea. You don't necessarily want to be talking about this during the holidays, but you'll figure out a time and give the people a chance to come around.
Let me just add one other thought here, because sometimes these conversations also can get heated in that there may be property, resources at stake. There may be hard feelings among family members, difficulty communicating, potential lawsuits. So if things are at that level, there's a good group here in North Carolina called Elder Matters, and they're basically elder law mediators. So if it's a bigger issue where there's a high level of conflict in families and discussions, and who's competent and who's not, that they can come in often and help mediate a situation like that.
That's really a good point. There's also right in Carborough, there is the Dispute Settlement Center, and they handle those kinds of cases. So that's a really good point. Yep.
Wonderful. Thank you so much, Sheila, Ina, and Colin, for those comments. Any more questions from anyone out here, our participants in the group? I don't see any new updates. And we also do have a thank you from the comments for the questions that you've been asking. But I don't see any other questions. Please feel free at this time to ask any questions you may have for our panelists. They've done an amazing job today. I've learned so much and very appreciative of their time and attention to detail on such a sensitive matter that can be kind of difficult for us at times to discuss openly with loved ones. So very appreciative of it. We have a comment. Thank you all. So we have a very positive comment there. I've enjoyed being your tech support for this evening. That's been very helpful. All right, here we go. What suggestions can Colin and Ed make regarding situations where healthcare professionals or institutions fail to abide by the agent or documents? That question was for Colin or Ed and Ed.
Well, listen, I'll kick it off and I'll let Colin, who's a much more accomplished attorney, answer. That very point is why this Supplemental Advance Directive has been drafted. That very legal question, because there will be pushback from some healthcare professionals or institutions. And I would point out that if a person happens to be admitted to a Catholic facility, the Catholic Church is against VSED, has pronounced itself opposed to VSED as well. So that an institution might not be able to abide by the wish for ethical reasons. In that Supplemental Advance Directive that was displayed, that Kimberly showed, at the end of that document, it asks if the institution is incapable of following this order for internal ethical reasons, that the individual should be sent to an institution that can abide by this. But to answer the question, which is a good question, unfortunately, it may come down to a court order. That is what we're talking about, that there will have to be a test case where this document is challenged, where a healthcare professional or institution refuses to abide by the clear directions that are expressed in the document, where the healthcare proxy has said the individual's reached his endpoint or her endpoint. And I'm asking as the proxy that you suspend hydration, nutrition, and the institution refuses to abide. It's going to take a court challenge. And the courts will decide, and if there's a court order, the institution will have to abide or face contempt of court.
Great, thank you for the question. Yeah, it raises the issue of, well, if you do not have your healthcare documents in place, then yes, you are really potentially opening yourself up to a lot of disagreement, misunderstandings, and you don't have as much legal backing for the desires that you may have. So the first response would be, yes, that's what makes having these directives in place even more important. But secondly, there are a couple of situations you may be referring to. One is where the family's kind of in an arguing with the medical providers as to what's supposed to happen. In my experience, what's more common is the family members are arguing among themselves about what should happen. And so that's where, certainly it can get to the point where people are starting to lawyer up. There are people that specialize in litigation around these issues. And so that's how decisions can ultimately be made. It's sad. I will say, just for people's knowledge, if you do not have a healthcare power of attorney, it doesn't mean that the doctor is just going to make their own decision. Most healthcare systems like UNC or Duke, they have a protocol, and it's usually something like, well, even if they don't have a healthcare power of attorney, we will talk to the spouse first, then their next of kin, and they usually have it kind of detailed down that way. But again, without that document, then it's much more open to judgments, and it's not as clear what your wishes are, and that just inherently raises the stakes and the possibility that there's going to be conflict that has to be resolved legally.
Thank you so much, Ed and Colin, for those comments. We have a question of, can 5 wishes be emailed?
No, it's a complete booklet that needs to be mailed. So we can send those out to a person's address, but the key factor is that it needs to be notarized. So we do have notaries that are available at both of our senior centers, and we have staff on deck that will be willing to witness for any resident that needs to have that completed. So we can mail them, but we can't email them.
Thank you, Shanae. That is all the questions and comments I have at this time. And thank you, everyone who was in the chat box today. Thank you for chatting with us.
All right, one last call for any questions or any comments. All right. I would like to thank everyone for joining us this afternoon. We really appreciate you coming out and supporting our End of Life SRT and their event End of Life Care Planning. I'd like to thank Janice Tyler, our department director, all of the Department on Aging staff for their endless support and participation in all of our events. And a huge thank you goes out to Sheila and Ina and Colin and Ed for being our wonderful presenters and providing such valuable information for everyone this afternoon. So we hope that all of our attendees walk away with valuable information that you can use to inform make well-informed decisions on what your end-of-life care plan should look like and how that will be implemented with your loved ones. All of the attendees will receive the complete PowerPoint that has all of our speakers' contact information, plus all of the valuable documents and links will be included. And if there are any other requests that you have, you can feel free to email me or email Kimberly, and we will make sure that we get whatever information you need out to you. So again, thank you all for joining us. I hope you have a wonderful evening, and we'll see you at our next event.